We're thinking about ways of ourselves as clinicians or non-researchers, if you like, getting involved in using information. Think about building a community in your local area, whether that's in your clinic or whether that's connecting with a colleague who's in another city, and having those regular catch-ups so that you're sharing the workload of trying to keep on top of all of this research work that's happening.
Hi everyone, Danuja Seelan here, editor of the independent study courses for the Ortho Academy. Just got a chance to talk to Dr. Clare Ardern. She's the editor-in-chief of JOSPT, which is a journal that we all know and use when we talk about clinical practice. We actually spoke a bit about how to actually get more involved in research, specifically from a clinician side. I think she brings up a lot of different interesting topics and pragmatic, tangible ways to get involved. And so hopefully you get something out of this conversation. All right, Dr. Clare Ardern, thanks so much for joining us today. I know you're a very busy person, but this is a very important talk. So just thank you for being here to talk to us today.
Thanks so much for the opportunity, Danu. It's great to chat with you and to have a chance to connect with the AOPT audience.
So a big part of what we're trying to talk about today, I think, is research. Obviously, that's your wheelhouse, but a lot of people don't know maybe how to get involved in research and how to be a part of research beyond just being a consumer. So obviously a number of people know your research from Return to Play and all the orthopedic and sports research you do, but now more recently as an editor within JOSPT. So can you kind of tell people that don't know you personally, but maybe know about you, kind of who are you and maybe how you got into research, maybe like your history about that?
Sure, really happy to. So as people might hear from my accent, I grew up and trained in Australia. So my original clinical training and my original research training as a PhD was in Melbourne in Australia. And as you say, that was in return to sport, in ACL injury and return to sport after ACL reconstruction specifically. And I got interested in sports medicine. Like a lot of us, I think I had experience as a young athlete getting injured, and then that's really what drew me into PT as a clinical degree. And as I was studying PT, I was exposed to more research. I think the beauty of working in or studying in that academic environment is that we're all exposed to academic faculty who are doing research as well to varying degrees. So that's where I learned about how research really happens, and we were blending. Or I was seeing how research is happening in the academic faculty, and we were also learning about using research in the academic program. And that's what really got me interested in trying to better contribute to the work or contribute to the research work that is underpinning our profession and the clinical decisions that we make. And as a young PT student, I had the great opportunity to contribute to a research project and lead a small research project in my undergraduate degree. I was doing PT back in the days when it was an undergraduate degree in Melbourne. And then that really lit the research fire, the fire of passion to continue with it. And then, of course, PhD. And then beyond that, I've built a career around return to sport, and then now moving more into primary care and access to musculoskeletal care and trying to improve the research that's underpinning some of the musculoskeletal service delivery that we have. And that path has led me from Australia to working in the Middle East as a sports medicine researcher, to working in Sweden, doing a lot around psychological support, and then now in Canada, as I say, working much more in the access side and service design side of things. So it's been a diverse career, which is one of the great things that research affords. You can work internationally, you have opportunities to collaborate with many interesting people and work on many different projects.
Yeah, you've been everywhere. You've been doing a lot of different things, which is really awesome. And then that allows you to have a unique perspective and a very diverse kind of understanding of different things. From my perspective as an educator, academic, researcher, and clinician, there's a whole lot of research out there. And there's so much, and it's impossible to consume it all. So I kind of drift myself towards research that's clinically relevant, because that's, I think, what helps my patients the most. Can you kind of speak to, I know with JOSPT, there's always been a high prestige level with JOSPT, and there's been a high prestige because there's such great research that comes out of JOSPT. I've noticed when you took over as editor, there seemed to be a switch, maybe, to more of an emphasis towards making things clinically relevant, and really tying it back to what people do as clinicians. Can you kind of speak to if that was a specific switch you intended to make, or if that was kind of something that just happened, and maybe why clinically relevant research is so important?
Thanks, Dinu. Yeah. So let's start with the why is it really important. I think all of us will recognize that we're trying to help. We're trying to do our best to help patients. And I think the way that researchers can best help clinicians to help patients and athletes is to create as clinically relevant research as we possibly can. And that means asking the important clinically relevant questions. It means measuring important clinically meaningful outcomes. So through that whole process, right from the conception of the research question itself, thinking about how are we going to design a research study that truly does get at the question that matters most in clinic, as opposed to designing a research question that might not quite answer the clinical challenge. So I think that's where we talked about diverse teams and getting diverse teams and people involved in research. That's where having diverse teams is really important, because if I'm sitting in my academic office and not interacting with clinicians who are doing this day to day, then I don't know what the really important clinical questions are. And for me, that's a really key part of the research work that I do, is partnering with the community, whether that's partnering with patients, partnering with clinicians, talking with health administrators, getting their perspectives and actually including them in the research teams so that they are helping to design the research, figure out how we're going to do the research, what questions we're asking, what outcomes we're evaluating, and then at the other side, how are we getting that information out to the community so that people who are on the ground working day to day in clinical practice have that information in a way that's accessible. And that was very much the perspective that I brought to JOSPT back in 2018 when I had the privilege to start working as editor-in-chief of the journal. And it's very much how we do business, if you like, as a journal. We're really trying to help clinicians help the patients and athletes with whom they work.
Yeah, you spoke to diversity of teams and bringing in patients, and that's an essential component of clinical practice to be able to transfer it to the people that need it, right? Because again, maybe it's my perception, but research historically was trying to find the cleanest way to answer a question. When you clean things up, you move it away from what's real, in a sense, and you take out all the confounding variables and you take out contextual factors, and then you make it harder to actually apply to the people that you're trying to use it with. And so pulling in patients to actually be on the teams is really essential. Pulling in clinicians to be on these teams is really essential. If I am a clinician and I don't have a background in research, but I am trying to get into research, what are some ways that you feel are some tangible ways for clinicians to get into it? Kind of similar to you as a PT student, you kind of latched on to a faculty member's research, and that kind of lit the spark. I was able to get into it based on a physician that I worked with. He asked me to be on a review, and then it turned into a case report with a ton of mentors that really helped me, and then an academic degree in research. But those people that don't have the time to maybe go get a PhD or don't have an interest, but do have a passion for research, what are some ways you think these people can get involved?
It's such a good thing to talk about, because I think it can sometimes feel like research is this thing that happens outside of my control. It happens in academic environments, in universities that I'm not connected with. It gets published by these prestigious academic journals that that are pretty impenetrable to me. I don't really have a sense of how I could possibly connect with them. And that was very much something we wanted to change at JOSPT. And we're constantly working on trying to create an environment where everyone feels that they can contribute and that they have an avenue through which they can have their voice heard. So, as you mentioned, there's the obvious, very structured ways of getting involved in research through doing a master's degree or a PhD or another higher degree in research. If you are interested in formal research training and leading research teams, then that's kind of a necessity, really. But that's not to say that there aren't informal ways of getting involved in research. And some of that might look as simple as writing a blog post. And that was why we started the JOSPT blog, was recognizing that for many people, they're not interested in going and doing the higher degree in research, but they are, as you say, very much interested and invested in the work that is done and in discussing that work. So the JOSPT blog is a really nice example of a place where you as a practicing clinician can write, get your ideas out there, and it's an avenue to discuss those ideas and perspectives with others. Starting a journal club in your local clinic is another great way of doing that, where you're bringing in your colleagues, you're getting to discuss what's going on, where are the new articles, you're sharing the workload, because I think often it can feel very overwhelming. There's so much research getting published all of the time. How to keep on top of that is challenging, and building a team around you to support that work and also to support each other to find out new research that's happening or has been published. Think about how you might implement that in the clinic, thinking about whether this new paper is really even worthwhile looking at a new intervention, or you simply don't have the equipment or the space to do that very complex intervention. So I think we can go from the very formal academic structure through to the quite informal networks and pathways. A lot of the clinician partners and patient partners with whom I work now, those connections have been made through people who I've either met who are coming in to teach in the academic program as clinical instructors and they're clinician faculty. So there are certainly, if you have ways to connect with your local PT community or academic community, there are certainly ways of connecting with the faculty who are doing research there and contributing to their research projects. Academic faculty are always looking for clinician partners and patient partners with whom to work and to get feedback. So there's lots of different ways, and I think even connecting with people at conferences can spark some of those opportunities to collaborate. So looking for those less formal ways is often, I think, a way to find something that you can shape that will work for you and will also feel like you're making a meaningful contribution to research.
Yeah, those are great ways to think about doing research and being involved in the process, because it's a very big process. The dissemination, the publication is just one little bit. But there's so much that goes on that I didn't know about until I started doing a little bit more research or getting involved with people that do the research. And one way I've found that as an editor to get people involved that are really passionate about it, that have content expertise in it, is being a reviewer for a lot of these journals. There's always a need for reviewers. It seems like there's always a shortage of people that have the time and ability to really be a critical eye on submissions. And so I very much value people that do that. I'm sure JOSPT does also. So let's also assume, though, that these individuals, they have a research question. Maybe they have a mentor, but maybe it's somebody that's not Clare Ardern that's published 1,000 times, Let's pretend that this is somebody that's more of a new person to research. When someone is submitting, let's say they want to submit a case report or they want to submit a narrative review or whatever whatever the project is, one thing that I tell people, the first thing to look at is instructions for authors when you're submitting to any journal. Just make sure you're specific to that process. From a bigger perspective, though, like from a 30,000-foot view, as an editor, as a researcher, as a clinician academic, what are some of the major maybe limitations you see, or not limitations, maybe some errors people make on the front end when they submit that they could potentially modify around to improve their likelihood of getting their work disseminated if they were to choose that route?
I think the first thing I'll say is that most papers that are submitted to any journal get rejected.
Mhm.
That's not to say that the work itself is not important. It's usually reflecting a mismatch between the journal's priorities or the journal's primary audience and the work itself. So it's very easy to say, and can sometimes sound trite to say, oh, please don't take it personally. Of course you take it personally
Right,
because
right.
it feels like a personal critique.
Of course.
It is a really important message to send, though, that journals receive so many submissions, and I as an editor, we as an editorial team are always making difficult decisions and trying to balance priorities. Is this the 10th ACL paper we've considered this month? And that, again, doesn't mean that it's a bad paper. It simply means that we have lots of different competing priorities. We need to consider the breadth of work that we publish rather than turning the journal into the journal of ACL injuries as an example. So I think you're right, Dino, that checking the instructions for authors is a really important thing, making sure that you are aligning with the journal's scope and mandate. And there's usually a page on the website that will tell you what is the scope, what is the focus of the journal, and making sure that you are aligned with that. I also find thinking through who is the audience I want to read my work and where do they go for information. So if your audience are sports PTs or orthopedic or PTs working in orthopedic practice, then JOSPT is a great avenue because that's often where that audience is hanging out. If you're trying to reach orthopedic surgeons, then you might think about another journal that's very much focused on orthopedic surgeons. Or if you're trying to reach a multidisciplinary team, then you might need to craft your message and craft the way you write your introduction in a slightly different ways so that you can show the editor, and whether the editor is me at JOSPT or whether it's an editor at a different journal, you're really trying to tell a compelling story for why this research is important for the editor's community. So thinking through who are you trying to reach will help you figure out what's the best journal or the best medium to convey that message. And I would really encourage people to think about writing for the audience. Who is it that you're trying to write for, as opposed to picking out a journal and saying I'm wedded to getting my work published in a particular journal? Because I think who I'm trying to reach is a much more important starting point than having your heart set on a particular journal. And then I guess the other thing is looking through it, certainly having a look at the sorts of work that the journal has published. And again, these are general principles. This is not necessarily just about JOSPT. I think these principles apply for whatever journal you're targeting. Having a look at what other sorts of papers they've published. Have they been publishing a lot of systematic reviews, or do they never publish systematic reviews if you've got a systematic review? So those sorts of things will give you clues as to whether the work that you're working on is a good fit for the journal. Some editors are happy to do a pre-submission review. I get so many of these emails now that we actually don't do them very often because it's just so overwhelming and takes us away from working with the submissions that we have. So I understand it's challenging because you don't want to put a ton of work into something and then have the author send it back immediately. So I think there's a bit of work that you as an author can do on the front end, really trying to understand your audience, who you're trying to reach, and where are they getting information from to help guide some of the decisions that you make. And certainly if you're choosing JOSPT, we are very much looking for what difference is this work going to make in practice? How is your work going to change the decisions that clinicians and patients are making together in practice tomorrow or on Monday or whenever the next clinic day is? So we're really looking for that immediate impact on clinical practice.
Yeah. Those are great points and those are great suggestions. And as I was listening, I was thinking those are great points for researchers too, not just clinicians getting into research, but researchers who, again, I don't know that initially in my career I was thinking about who am I trying to talk to when I wrote a paper. It was more, here's my topic and let me make sure I get it to the journal I want to get to. But maybe not the other way around. But also, it made me also consider, as we're talking about getting clinicians maybe more interested in research and maybe avenues to disseminate their interested projects, how do we potentially, as a researcher and as an academic, how do you actually get clinicians involved? Like, what's a tangible way to flip that and not just be the clinician that gets involved, but how do you start those connections from a research to clinician side? So these junior researchers, how do we get them to be more active with pulling in clinicians too?
I have found, as a person in that position trying to engage with the clinician community, going to conferences that are very much focused on the clinical audience. I I just like talking with people and learning from people about how they think about the work and how they're thinking about whether this work applies in practice. So most of the most meaningful connections I've made with clinician communities have been often at those sorts of meetings, and really listening to what is it that challenges clinicians and patients, and how could I work with these people to try to design studies that better address those questions. So conferences are a great avenue. I've certainly made those connections through, more recently, where we've not been at conferences so much, through webinars and some of the many online events to connect with people. I am often, when I'm at those events or online, I'm often looking at the questions that come up in the Q&A or in the chat when people are talking about what's about the work, and trying to think, what would that mean for me? And is this a person who I really would like to learn, who I need to learn more from, who I need to connect to try to explore that particular clinical question? So I find those sorts of fora are the best ways to learn more about what's going on in clinical practice, and then reaching out to the people who are working on the ground to have those sorts of meetings. The other thing I think is important as a researcher to think about up front is that, as researchers, we're paid to think about this stuff, to design studies and to do the research. Clinicians and patient partners are often not. They're often not connected to an academic institution. So for me as a researcher, it's really important to build in ways of recognizing the work that goes into that. And for some people, that's an honorarium, and we build in honoraria into our grant applications, and we look for different pots of money around the place to recognize the time and effort that people are putting into this work. For others, the financial compensation is not the thing that they're looking for. Sometimes it's giving people an opportunity to attend a conference and present the work that we have done as a team from their perspective as a patient or as a clinician partner. So thinking through up front and talking with the prospective people with whom you might want to partner, thinking about how you can make this meaningful and also doable for that group is really important. If you're having a meeting, an in-person meeting, and you're working with a patient partner, the person might have mobility needs that you need to accommodate. So perhaps you need to budget for an extra night's accommodation, or so thinking through and talking with people what they need to help them show up in a good way and to do their best work to contribute to the research team is a really important part of making these partnerships function well, and where people feel like they're not being taken for granted or they're not getting the recognition that they deserve.
Yeah. Yeah, it's more of an intentional process, and it's got to be intentional from both perspectives. Obviously, there's cases where it just happens, you kind of fall into it, but more often than not, it's not that way. But from research perspective, we can be intentional. From clinicians, we can be intentional about making products useful for the people that we need to serve, and that's, I think, a priority that's clear that JSPT has, and hopefully that's many journals. Um, but kind of taking a step back, if you had to talk to clinicians, if you had to talk to patients, if you had to talk to researchers, what are some maybe key like parting shots that you would have? What are some things you want people to take away from a clinically relevant research perspective from your eyes?
I think one of our strong areas of focus at JOSPT has been on engaging patients and the public in doing research. And we've been talking about different ways that people can get involved in research, or different ways that researchers can connect with patients and clinician communities. I think to underscore that, we published an editorial a few years ago now where we said patient partnership, it's the right thing to do. And I really strongly believe that engaging with the people for whom the work is ultimately intended, the people who are going to hopefully use that work, is so critical. Because if you don't engage meaningfully with those people, and that's not simply having a conversation once you've done the research to say, oh, do you think this is any good? It's genuinely engaging people, as we've been talking about right from the outset, getting them involved in deciding what are the research questions, what are the important things that we need to study here, what are our research priorities, how are we going to study that, what are the outcomes that we're going to measure, and then how are we going to make sure that that information gets back into practice. It's these partnerships that build strong avenues for actually getting that information back into practice and getting the information into the clinician's hands or into the patient's hands, and in a way that is going to have a positive impact or a meaningful impact on the care that we're providing for the patients or athletes for whom we care for. So I think, to me, the ultimate reason for doing this is it's the right thing to do, and it takes time. And you've got to, as you say, Dinu, you've got to do this intentionally and with purpose, and also with enough planning time to actually to allow people to meaningfully engage. So I think that's the most important thing. And then if we're thinking about ways of ourselves as clinicians or non-researchers, if you like, getting involved in using information, think about building a community in your local area, whether that's in your clinic or whether that's connecting with a colleague who's in another city, and having those regular catch-ups so that you're sharing the workload of trying to keep on top of all of this research work that's happening. There, as you say, journals are now doing a lot more work up front to try to disseminate information and find better ways, new ways, better ways, one could argue, to disseminate what used to come in a paper printed journal article that it was pretty inaccessible for a lot of people. There's a lot of work that researchers are doing, journals are doing, to try to break down some of that sometimes frankly incomprehensible writing. We're trying to help people write in more engaging ways, and certainly those research partnerships help with that. Creating infographics, JOSPT Insights podcast was a very intentional way to try to connect with the community and trying to help researchers get their information out there to clinician communities, patient communities. So there are lots of products out there to help you engage with information. And if there's something that you see is missing, then I, as an editor, and I'm sure that researchers generally on the whole want to hear about that, because we are trying to work better together, and certainly that's one of the things that underpins the work I do, is that we're stronger together, we're better together. So if we can find ways to constantly work on these collaborations and these partnerships, then I think that is what's going to drive us to doing better research, to doing research that's more clinically impactful, that works better for lots of different communities. That means we engage with the diverse communities for whom we serve, so that our interventions are not simply designed to work well in a high resource setting. We're thinking about low resource settings, and we're thinking about all of the patients who are within the community who might benefit from this work. And how do we create research that's meaningful for patient and clinician communities? We have to reflect those communities in the research teams that we're putting together, and in how we're disseminating that work once the research is done.
Yeah, absolutely. So for me as a clinician, academic researcher, all this stuff, my time is limited, and so when I do pick up a paper and I do think it's going to be useful, when it's not, it really frustrates me. So making research clinically relevant, something tangible, it's so essential and so important. And being